To me, it means that people have equity. Everybody has an opportunity and fair chance to be healthy and happy human beings and to have access to whatever anyone in society should have access to. For me, a particular piece is the problem that we have with adequate access to mental health care, because it still carries a stigma, and people with mental illness are marginalized. It affects people's life as they're aging and their ability to be functional, the ability to have quality of life, because they don't have access, also because whether we call it unconscious bias, and sometimes it probably is, sometimes it might be more conscious, that there's another person who's different from us in healthcare, and we have good research on this in terms of mental health care. The more you're different from me, the more likely I am to label you with a more serious illness or the wrong illness. I really believe that healthcare is a right, not a privilege, that basic healthcare is a right. And for me, what we now, and now even medicine here in the U.S. is accepted as social determinants. WHO, the World Health Organization, has used them for a long time. But that, you know, there are factors in our society that affect healthcare, so how do we look at those and address those? And I kind of use and talk to my students about, whether they're nursing or health students or non-nursing, non-health students, about the idea, which fits with social justice too, of emancipatory model, where it's about advocating for everyone having access to care, but also understanding the social structures and constructs. And so the question you ask is, what's wrong with this picture? Who benefits from what's wrong with this picture? And so then you work at advocating and trying to impact policy as well. Many nurses are very involved in policy issues around access to care and things like that, and what you do about that, which is a big social justice issue, because how well someone's educated, what their income is, what zip code they live in, all of those are part of health, and part of whether health is good or bad or more difficult for someone to maintain. I think it's important to have a visible, very tangible physical space where people come together to support, talk about social justice, and to engage people across the spectrum, even those who think maybe it's silly to have Social Justice Institute. And here too, as a university, it's critical that faculty and students learn to listen and talk to one another and appreciate each other's humanness, but appreciate the similarities and differences. But part of what you should learn at university is to learn about the diversity among people, but the similarities as well, and learn how to talk and know each other. And also, I think it's a piece for me of the idea, the old idea, when you're given a lot, especially as a faculty, you need to share that with other people.